Blood cancer is not an uncommon cancer, and despite it to be vastly popular for its myth as fatal, there are many other types of chronic blood cancer which is always disregarded by our community, but generally they do have better prognosis. Of course, as an individual, we prefer to be healthy, so here are general tips in keeping cancer away and staying safe from cancer. Number 1, don't use tobacco. Smoking has been linked to various types of cancer, including cancer of the lung, mouth, throat, larynx, pancreas, bladder, cervix and kidneys. And chewing tobacco has been linked to cancer of the oral cavity and pancreas. More serious than to the active smokers, passive or second-hand smokers have been proven to have risk of increased death due to cancer. So you need to urgently decide to stop smoking. Number 2, eat healthily. Consider eat plenty of fruits and vegetables, maintain a healthy weight, and if you choose to drink alcohol, do it in moderation and limit the processed meats. There is a report from the International Agency of Research on Cancer, the Cancer Agency of the World Health Organization, concluded that eating large amounts of processed meat can slightly increase the risk of certain types of cancer. Number 3, maintain a healthy weight and be physically active, and by maintaining a healthy weight, it may lower the risk of various types of cancer, including cancer of the breast, prostate, lung, colon and kidney. And of course, physical activity counts to maintain a healthy weight, and it helps you to control the risk of breast cancer and also colon cancer. In order to maintain the weight, physical activity counts too, and it helps you to lower the risk of breast cancer and colon cancer. And for substantial health benefits, at least 150 minutes a week of moderate aerobic activity or 75 minutes a week of vigorous aerobic activity. You can also do a combination of moderate and vigorous activity as well. And as a general goal, include at least 30 minutes of physical activity in your daily routine. And if you can do more, even better. Number 4, protect yourself from the sun and any form of radiation. Now, skin cancer is one of the most common kinds of cancer and also one of the most preventable. So do your sun blocking daily. Radiation like X-rays in multiple settings or nuclear plants exposure, especially in those with occupational hazards, can change certain genetics to be upregulated for developing certain cancers. So be aware of your social surroundings. Number 5, get vaccinated for hepatitis B and human papillomavirus. Cancer prevention includes protection from certain viral infections. Talk to your doctor about vaccination against hepatitis B and also human papillomavirus. Hepatitis B can increase the risk of developing liver cancer. The hepatitis B vaccine is recommended to certain adults at high risk, especially those who are non-monogamous sexually active. People who use intravenous drugs, men who have sex with men, and health care or public safety workers who might be exposed to infected blood or bodily fluids to hepatitis B also are required to be vaccinated. The human papillomavirus or HPV is a sexually transmitted virus that can lead to cervical and also genital cancers as well as squamous cell cancers of the head and neck. The HPV vaccine is recommended for girls and boys ages 11 and 12. Number 6, avoid risky behaviors. Another effective cancer prevention tactic is to avoid risky behaviors that can lead to infections that in turn might increase the risk of cancer. For example, practice safe sex, don't share needles, and get regular medication or medical follow-up. Now, number 7, which is getting regular medical care. Regular self-examinations and screenings for various types of cancers, such as cancer of the skin, colon, cervix, and breast, are utmost important to anyone. It can increase your chances in discovering cancer early, which is very, very important to institute treatment early. And when treatment is most likely to be successful, the follow-up and the prognostication will be much better. Ask your doctor about the breast cancer screening schedule for you. This is especially highly recommended for those who have family history of cancer. I hope these 7 tips helps. Do spread the message to those around you and keep cancer away and stay safe from cancer.